And good morning, and welcome to Women Who Rock Investigates. This is your show host, Miss Diane Winbush. We thank you so much for tuning in from Women Who Rock with Success Media. And so today we have a very interesting topic that we would like to discuss for mothers in America. That perhaps maybe deal with some certain issues in labor and delivery. So we want to talk about some topics in regards to that. And we also want to be able to share what you can expect in the labor room and delivery and how important the Lamaze classes are, if I'm pronouncing that correctly, for women as well. So there's a lot of things that we can be able to do too. So we want to discuss and share on both sides of the fence as to how you can be able to have a successful pregnancy and also how you can be able to be successful after the pregnancy as well. And then we kind of want to hit a little bit on the postpartum as to what some mothers have, and we may touch a little critical stories and what have you, but these professionals, that's what they're here for. I'm not an OBGYN, so that's the reason why I got the professionals to be able to help you to be able to understand just a little bit more. So we're going to get started. We have one of our guests that is with us on today. I have to take my glasses off, and she is none other than Miss Stephanie Larson, and she is the founder. She's been working in labor and delivery for the last 20 some odd years. So we know that we got the right people on the panel today. And then we also have another professional that has also worked in the labor and delivery, and they're going to tell you a little bit about themselves, and she is none other than Miss Lydia Robinson. So good morning, ladies, and welcome to the show.
Good morning. Good morning. Thanks for having me.
You are welcome. So we're going to start with Stephanie. So Stephanie, tell us a little bit about you. Tell us a little bit about what you do, and I guess what your passion is for women, and then for babies too.
Yeah, I am Stephanie Larson, the founder of Dancing for Birth, and I love to dance. So that's something special that I'm bringing to birth. I love to dance. So when I was pregnant, for the first time, I danced during my pregnancy. I was with a midwife at a freestanding birth center for my care, and she didn't have a problem with me dancing. So I danced during pregnancy. When I went into labor, went to the birth center, I had a room to myself, and they said, do what you want. So I hadn't preconceived this, but I danced because that's what felt good. There was a bed there, but I never got in the bed. So I danced around the room, danced in the shower, and 4 hours later, I had given birth to my baby. And the experience was euphoric, unmedicated, and I felt so powerful. I really felt like Superwoman. I was home within a couple of hours, out with my baby on the street, going for a stroll, and I just felt on top of the world. But when I talked to the other new moms around me, all I heard was painful, traumatic, scary birth stories. And that was a real wake-up call for me. But I realized I could help other people because dancing had helped me so much. So that's when I created Dancing for Birth. And it's a childbirth method that uses gravity, movement, and instinct to help birth your baby with bliss and ease. And it's also a class for pregnancy and for postpartum. And this was, that birth I described was almost 25 years ago.
Mm-hmm.
And so now Dancing for Birth classes are around the world on 5 continents, helping families around the world. And I have the pleasure and the privilege to be able to give advanced training to doctors, midwives, nurses, doulas, childbirth educators, so that they can bring this into their clients' birth experience.
Okay, awesome, because I think that's so important, and we're going to put a pin in that as well, because I want to really bring that out to mothers, because I also, well, I didn't dance, but I exercised, and the more exercise that I did with, I have a son, I think I don't know, he's 28. Ain't that something? I don't know his age. I think he turned 28 this year. But the more I exercise, it, according to what the OBGYN told me back then, it opens up the pelvic bone structure. And the baby just can't. I went in for 5:30. At 5:30, boom, he was out at 8:05. And so I think that is very, very, see, I told you I got the right panel on here today. It was very, very, it was very, very successful. And of course, you have these, we'll talk about that later and stuff. But anyway, come on, Lydia.
All right. So my name is Lydia. I have been a labor and delivery nurse for the last 10 years, working in all settings for birth. So I do high risk, births in the hospital. I've worked at freestanding birth centers as well as attended home births. So I'm also a childbirth educator, evidence-based birth instructor, and a international board certified lactation consultant. So I just like to tell my families everything from pregnancy through postpartum, I've got something to help you out. So for me, being in the birth space is something I always knew that I wanted to do since the time I was 8 years old. I'm the oldest of 5 children, so everybody around me was always pregnant. I also have 20, it's the truth, I also have over 20 first cousins, and I'm like the 4th grandchild. So again, everybody around me always pregnant. So at age 8, I knew that is what I was wanting to do. So I went into nursing school, and my first job out of nursing school was labor and delivery at a hospital. It was at that point in time, I was recognizing there were some things happening in the hospital that weren't right. It was, just the mindset of the only way to help women get through labor is to offer them pain medication. If they don't want pain medication, then, well, we don't know what to do. And because of what I had known growing up, I knew that this was not the only option. So it was at that point I became a doula, so that I could help incorporate some of those skills into my nursing practice and help the patients that wanted to go more low intervention, natural birthers. And then the other thing that I found while working in the hospital system was that there were a lot of things happening to women and their families throughout that process where they were being taken advantage of, whether it was something very small or something drastic in their care. And it was primarily due to lack of knowledge. So that is when I began taking private clients as a doula so that I could help to combat some of those issues I was finding in the labor and delivery room in the, in the hospital. So that's a little bit about my story and, just my drive and passion for what I do.
Okay, great. So we're gonna first, I guess we're gonna start with the questions in regards to the preparation for women and how we need to educate and coach women, not due to their income. I think this should be something that is available for all types of women so that the pregnancies can be successful. So we're gonna start with Lydia. And we want to talk about, Lydia, the importance of the doctor's office as to how much, and then too, it's not all on the doctor as well. We have to have we have to have the knowledge to go to get some of the resources too. So talk to us a little bit about the importance of, I'm finna go deep here on some things and stuff. I know some women that done sat there and done went all the way up into 9 months pregnant. Then here they go to the ER room and want the doctor to perform a miracle and things like that. But share with us the importance that women need to take in regards to their health. Share the importance of how the doctors need to inform them of their health, because a lot of times my stepmother, she's deceased now, but she went through toxemia. I think that's what she was telling me. She almost died with the baby and what have you. Some of the things were knowledgeable way before she went to the labor, and there was nothing done about it. See, that's a red flag right there. So we want to talk about these things as to how the doctors should be working to educate the mom, the mom before she gets into her birth, and then how important that the mother, I don't have children, I can't have no more kids and stuff, but how important the mother should be getting the resources as well.
Right. You're right. That is going deep because that opens
Yes.
a whole can of worms I can talk about for the longest. So,
Okay.
in regards to the mother, you have to recognize that it's your body, it's your baby, it's your health. Okay.
Mm-hmm.
So for
Mm-hmm.
everybody else involved, this is, even if there's somebody like me who loves what they do, it's still
Okay.
their job, right? So it's still
Right.
their Monday through Friday, 9 to 5 type situation. So
Mm-hmm.
they're only going to go so far when it comes to the things that they quote unquote should do or could do for your care. For
Mm-hmm.
you and your family, this is a life-changing, life-altering event. And there are some things that you can do to, better that experience. For pregnancy, you do want to make sure that you are getting regular prenatal care. Again, working in the birth settings that I work in, actually just 2 days ago, had a patient come into the labor and delivery room. It was her 10th baby. She had zero prenatal care. And so as the birth team, we're like, okay, we don't know what we're going to get out of this scenario. She was 9 centimeters dilated when she arrived. And she did end up having some immediate post-birth complications. But again, we had no idea of anything, and she didn't either because she had gotten no prenatal care. So making sure that you are getting regular prenatal care so that you're staying on top of your lab values. And if there's any concerns going on with you, that is something that can be addressed beforehand. And same thing with baby. We do know that babies can sometimes be born with birth defects and different problems, and it can make for an easier transition if you already have the staff on board at the time of your delivery so that they can be there to aid baby in whatever their needs are at that time. But again, if you don't know, you're not expecting anything, you can't have all those safety precautions in place. So that is one of the things that can be helpful on mom and the family's part. The other thing I want to say about that is majority of the complications that you may run into during your pregnancy birth experience, most of those things can be, adjusted by focusing on rest, water, and nutrition. We have to recognize that when you go through pregnancy, your body is completely changing. So maybe you could, run 3 miles, no problem, before you got pregnant, but now you're pregnant, and instead of just pushing yourself to continue to do those same things, you have to alter it. Okay, maybe now you can only do 1.5 miles if that's the sort of person you are. Or if you're the person who could run up a flight of steps, no issue. Now every 2 steps, you gotta, just pause and take a break, and that's okay. So you have to adjust, making sure you're not pushing your body more. It's okay to take a nap, okay, throughout the day, those 15-20 minute naps, or if it's 8 o'clock and you still have things to do, that's fine, go to bed. Okay, so rest. Water. The human body is over 70% water. And when you're pregnant, you have a big pool of water in the stomach. So if you're dehydrated, that can affect lots of things. That can cause you to go into preterm labor. That can cause a condition called oligohydramnios, where there's too low fluid around the baby. Lots of issues that can, in turn, affect the actual pregnancy and the birth itself, and then the outcome of you and your baby on the other side of things. And then nutrition, a lot of people have this mindset, oh, we're eating for 2 now, so I can eat whatever I want to. You're sitting on the couch, eating bonbons and Cheetos. That is not what you want to do. That is not healthy, no matter what situation you're in. You only need a couple hundred calories in addition to what you were eating before in order to sustain a pregnancy. So you're not eating for an entirely different person. And you want to make sure you're staying away from those processed foods. You have a little one that is being developed inside of you, so you want to make sure you're doing things that are, I know that goes totally against the American diet, right? But you have a little one inside of you that's depending on all the nutrients to build themselves. Okay, so rest, water, and nutrition, those are the main things that I want all pregnant women to know and focus on. From a doctor standpoint, medical healthcare standpoint, it's definitely important that we are focusing on something called informed care and informed consent. Going back to the reason why I actually became a doula was because I was seeing people taken advantage of in the health system. Okay. So if your doctor, they have the standard way, and this midwives too, they have the standard way that they prefer to practice. So when they tell you what your options are, they may only tell you 2 options, and that's because those are the 2 that they prefer. When in reality, you have 5 options. And maybe for you, if you knew about all 5 options, you would have gone with like option number 4. But because your medical provider didn't tell you about that option, then you do essentially what they led you into doing because it was their preference, and that's not informed care, because you can make decisions without it being informed. So on that part, it is very important that the medical team is being what I like to refer to as being transparent with the families that they're taking care of. You know, it's not lying, but it's like lying by omission, if you will. And I see a lot of that in the health system. So it really is just a cultural thing. It starts by the whole entire health system is broken. Let me start by saying that you can have some really, really great midwives, some really, really great OBGYNs, but because of the whole system having problems, those one or two here and there, they're not going to be able to make a huge change for the whole system. And so knowing that, then the ball goes back into the court of the women and the families. It's up to you to make sure that you are doing your research on the medical provider that you are trusting your life and your baby's life with. You want to make sure that you are in charge of your care. So you go to them because, you know, they have the medical training, but we kind of have it backwards. A lot of times people just say, oh, well, my doctor said I had to do X, Y, and Z. My doctor said I'm not allowed to do X, Y, and Z. Okay, your doctor makes recommendations. Mom, you make decisions. We have that whole concept backwards. It's not that your doctor tells you what you can and can't do. They make their suggestion to you from their medical standpoint, but at the end of the day, you have to do what feels right to you and your baby. Because sometimes I've seen this plenty of times. Mom's intuition, following her gut, it made no rational sense from the medical standpoint, but it saved her and baby's life. And I've seen that happen on more than one occasion.
Okay.
So those are kind of the main points. Like I said, I know I can be long-winded when it comes to that, but it's definitely recognizing that we have to take back control of our care. Women and families, they have, you know, the final say so when it comes to what happens. And then in the medical side of things, the providers need to learn to be more transparent and open and allowing their patients to take the lead on things.
Okay, great. Well stated, well informed. So we're going to go to Stephanie. And so Stephanie deals also with helping women to be able to, you know, kind of, have a healthy pregnancy, you know, healthy birth, exercising and what have you. And so that would be, I guess the next, we want you to elaborate on, I guess, the topic as well. And then after that, then we'll get into to the next segment as well. So if you want to piggyback on what Lydia had already kind of shared and discussed, you can do that at this time.
I would add that movement is that one of the critical components. So we do want to carry in the healthy movement that you were doing before pregnancy into your pregnancy. Try to be moving at least 5 days a week, at least 30 minutes a day. Move in ways that feel good to you. So just follow the comfort in your body. And the benefits of that are giving you more energy, giving you happy hormones like oxytocin, which is a love and bonding hormone. We get that when we dance. We also get that when we are giving birth. We need oxytocin to create the contractions in the labor and also to help us be loving and bonding with our baby right away. So that's really important. It's also really good for preventing depression during pregnancy, dealing with some depression that may occur after giving birth. So movement, and I would say go for it and dance, is really important. And then another critical aspect is finding the right birthplace for you and the right care provider for you. So recognizing your own expertise and your own wishes for your birth, and then finding that right place and that right provider who really makes you feel seen and heard, listened to, who does educate you about your options. And I would say look for a high performing birthplace. That would be one that has a low cesarean birth rate, high rates of breastfeeding, high rates of birth satisfaction. And yeah, also thinking about the kind of provider you want to work with. Are they someone who is a surgical specialist and their comfort place is surgery? Or do you want someone who has extensive background with unmedicated natural birth and following, you know, the body's blueprint for birth?
Okay, great. So the next thing we want to, I guess, talk about, we've already talked about some information, health tips and initiatives as to what we can be able to do, as far as the hospitals and what they can provide, because I know it's a responsibility on the mother as well, even if the physician does not offer all of these health. So we want to talk about the Lamaze classes, and we want to see where we are today in that area. Some individuals may have the appropriate assurance because of their husband's employment or their own employment that they can be able to afford Lamaze classes. But we want to be able to see where we are today in that area as to, and I'm pretty sure I know that you offer this, Stephanie, as well, but we want to talk about in all types of demographics as to where we are today and why this service is not offered to everybody so everyone can be able to have a healthy pregnancy and a healthy outcome with their baby. Lydia, you can go first.
Okay. So why this is not currently offered to everyone, is that what your question is?
Yes.
It goes back to the fact of this has been turned into a business, the practice of having, babies. Everyone used to be born at home, right? There were a group of, trained professionals for childbirth, specifically referred to as the grand midwives or the granny midwives. They were Black women who, for, generations, they were the community health providers for, for everyone. Once obstetrics came about and they figured out that they could monetize this birthing process, then the grand midwives were criminalized and it became illegal in many places for you to be a midwife and birth outside of the hospital setting.
Right.
A lot of places now, even like Georgia and Alabama, they're still facing those same laws. So in that way, it turned birth into being in the hospital setting. And it was there that they found the things that they could do where they got paid for it. So that's sort of the mindset we are still in, because there are many things that we know regarding birth itself and how we practice from a medical standpoint in the hospital system. It doesn't match what the evidence tells us.
Okay.
Something really simple that shocks a lot of people is you should be eating and drinking when you're in labor. That is something that the evidence tells us that you should be doing. However, most people, even if they've never had a baby, they know, oh, you can only have ice chips when you're in labor, right? Because that is the common thing that has been passed along. But that is something that was introduced when birth went into the hospitals. And it's actually a very, very outdated practice. The reason for that is because you're pretty much a surgery patient waiting to happen as soon as you step into the hospital. So even though we know that eating and drinking is beneficial to the laboring process, to the body needs fuel and energy to go through that process. The hospital says, nope, you can't eat or drink. And if you ask, if you have the gall to ask why, it's because, oh, in case we need to take you back for a cesarean birth, we don't want you to have anything on your stomach. And again, that is not an evidence-based practice. And that's just something really, really small. But not having enough energy for your body to continue on with the process, that can lead you to a stalled labor that does in turn lead to a cesarean birth or other assisted operative birth processes.
Okay, great. Stephanie, so we know that you already have basically like these classes that are already formed, already pre-formed. You already offer this for individuals. Talk to us a little bit about and take us into like an initial process as to what you talk to your clients in regards to this when it comes to Lamaze classes, because these are important. Exercise, and we have to exercise. And so talk to us a little bit about that.
Yeah, childbirth education is so important. And it's also, so we have to learn research, we have to learn intellectual ideas, but we also have to start debriefing from societal fear of birth. And so childbirth education is a great time to do that. And my childbirth education classes are called Dancing for Birth. And that's a combination of prenatal and postnatal fitness, childbirth and parenting education, and then celebration and support of all things pregnancy, birth, babies, and postpartum. And so this community getting together and week by week by week, talking about what they don't understand, what their answers that they're seeking, things they're feeling in their body, and doing that with an experienced birth professional who's a mentor is very important. We don't want to bring fear into the birth room, and it's hard not to, because in today's society, there's a lot of fear associated with birth. But you can't birth that way, because you have fear that causes tension, that tension causes pain in your body, the pain causes fear, and you go around and around. So we really want to interrupt that by feeling super confident that you know what your body's capable of, you feel good and healthy, you have the information that you need to be able to make your informed decisions about your care, and you feel confident to assert yourself in that situation. And then you've also been educated on how to find provider and a birthplace that really resonates with you, because we want to not have drama in the birth room. We want everything just focused on a beautiful, easy, blissful birth experience.
Okay, perfect. So before we go to the next segment, and so both of the professionals, you can be thinking about this on the next segment. This is going to be once the mom gets into the actual labor room. So just put a pin in that right there. We have another guest that's in the studio, Miss Debbie Young. She wants to come forward and share a brief story of hers with the audience. So go ahead, and good morning, Debbie, and thank you for being here.
Good morning. Yes, this is exciting to be with you. I'm so glad that I got the link. I'm an educator for 35 years and a doula for 34 years.
Okay.
I so appreciate everything that Stephanie and Lydia are saying. And one thing back to how are we going to make sure that everybody has access? I think community education and community doulas are really important, and private practice doulas can offer scholarship or low payment or something like that. So we just have to be sure everybody has access. You were talking about being able to choose between not just two choices, but all the choices. And I just had a couple in class who were told by a perinatologist that they were going to deliver at 37 weeks without really, the baby was small, and they had a scan, and without any discussion, he said, okay, well, that's what we're going to do. You're going to deliver at 37 weeks, and started to walk out the room. And he's like, the parents were flabbergasted. And so in class, they asked me, why do I have to deliver at 37 weeks? I said, I don't know the answer to that, but you certainly need to ask why. And so we went through some scenarios. We went through the benefit risk alternatives, intuition, and then answering. We went through all of that, and they had decided to have 2 more consultations with different caregivers to make sure that this was an actual necessary thing, because mom's intuition was it wasn't necessary. She and her husband were both small, 6 pounds, under 7 pounds, and this baby was just about in that range if you extrapolate. So I think it's so important for us to be the voice that the voice of reason, the voice of making sure that parents understand that birth is a consumer event, right, that they get to ask all the questions. If they were buying a house, they wouldn't just take the one that the real estate person said, oh, this is a good one for you, we're going to go with that one. They would have their own input and ask their own questions. And I think the first thing I say every time when I have a class is birth is nothing like television. So just know it's important to understand that's not true.
Okay. Well, thank you so much, Debbie, for being with us. Just hold a pin right there. We'll maybe calling on you later on. Okay. So this next segment we want to talk about is in the labor and delivery room. We know that we have had some stories about mothers, especially African American women. We're going to address it now. That's what I put on there before I reached out to the professionals beforehand. And so we want to kind of help them also, all cultures, to be able to understand. I guess the ratio was where there were a lot of women that were dying on the birthing pad. And it was more African American women than more other women in the U.S. And so we want to discuss that. They even did a a segment on it on ABC News, and so the topic was very, very prevalent. And so there was a lot of, of course, a lot of offense to it. And so we want to talk about that fact in regards to that, because I think it was, we had the Roe versus Wade, and we're not going to get into that, but we also had this one individual American. The African American lady came forward. I think it was last week or week before last, and I think the baby's skull was not totally developed or something like that, and she wanted to terminate the fetus and what have you. So, I mean, we're not going to get into the Roe versus Wade nor the abortion issue, but we do want to talk about some things, because my heart is heavy for some of those women. I'm sorry. My faith does not agree with some of that, but my faith does agree with the women where they have issues in regards to, what do I do if somebody assault me? I mean, then I still have to carry this baby and what have you. So we're going to leave it right there, but we want to talk about the birthing pad and what type of steps first of all, how important, let's go here first, how important and effective it is for the mother to have a bond and relationship with the physician. That's the first, that I think that makes a big difference right there. And then that will kind of help us to be able to answer the second portion of that question. So we're going to start with Lydia first.
Okay. So it's very, very important. A lot of people just go into birth blindly, and then that's where they end up getting taken advantage of. They don't have the best outcome for themselves or baby. Again, going back to that is the reason why I actually decided to become a doula and take on those private clients. So much of what happens can be avoided if you are educated. Okay. So with my private duty nursing clients, or with my private doula clients, I spend so much time during the pregnancy phase educating them on what is normal, what are the red flags for your body during pregnancy, birth, and postpartum. We go over things with breastfeeding, and we go over things to look for in a safe birth setting, and how to identify a provider who is going to benefit you and allow you to be in a safe space. Because like Stephanie said earlier, we want to do everything we can to set ourselves up for success, so that when it comes to the actual day of birth, you're just there to meet your little one. That's all we want to do. We want to be able to avoid, combative or negative birth experience settings whenever possible. So that's step number one. You can't just go into it thinking on the day of birth you're going to do something drastic to make a difference. No, it starts before you ever show up to the birthing facility to give birth to your baby. Okay. So that's where having that education piece, making sure you identify a solid team. That's where having a patient advocate, also known as a doula, throughout the course of your pregnancy comes in handy. I think that is definitely something that should be mandatory for, all women who are giving birth, because it's kind of like, you're a tour guide or like a wedding planner. They have done this plenty of times before. They, can help get you here or there with certain deals, and, they know what goes best together, and they can help you to have a positive birth experience. So that's on the front end of things. And then specifically what you're referring to is actually the maternal health crisis right now that we're going through. It's the Black maternal mortality. In the United States, Black women are dying at, 4 times the rate of white women in America surrounding childbirth. And that is a staggering statistic. I feel like this is something that has become more I'll say, widely known within the last couple of years because
Yeah.
of some different headline stories.
Right.
Me being in this work for over a decade, I've seen it live and live in color on a day-to-day basis. If you are not white and you are moving through the world, you have a completely different experience than someone who is white moving through the world. Specifically, when it comes to Black women are the lowest on the totem pole when it comes to anything. And we see that in the statistics for Black moms and Black babies in the birth world. And this is not because, oh, they're unhealthy or Black women are doing something they shouldn't and their genetics. That's not what it is. It simply refers back to systemic racism. That is the problem, okay? This is the problem in the world. So why do we think that that would not translate over into the birth space? It doesn't matter where you go. That is something that's always going to be something that you have to put at the forefront of your mind. I can also say that what I've witnessed myself in the hospital setting, if you don't speak English as your first language, you're also going to run into some of those same biases and challenges, stereotypes, and maltreatment in the hospital system. So again, this is the issue within the entire system. And we kind of have to recognize kind of the foundations of the system and where it came from. Going back to the grand midwives, that's when birth was in the community and we had better outcomes and, we had skilled providers to get us a physiologic birth. Then when it moved to the hospital and obstetricians, they are trained surgeons. So their skill lies in surgery. If there's ever going to be, a problem, then they're going to try to find an operative intervention to help solve that because that's their area of expertise. So when that happened, we also recognized who was the first obstetrician, who was the person that they call the father of gynecology. He was a man named Marion Sims, and he did all of his, studies and research on enslaved Black women who he was literally torturing for the benefit of his research. So if he is the person who, quote unquote, founded obstetrics, and then he was the one who taught other medical physicians. And I've seen racist things even in my nursing textbooks in college. So it trickled down because if the foundation of something is racist, it's going to affect, even present day situations, which is what we're seeing for the Black and brown women that are giving birth. So that's all I have to say about that. That is the problem. So everybody can benefit from having a doula, but when it comes to Black and brown women, it's something that shouldn't be looked at as a luxury. It should be mandatory because we already have all the odds stacked against us. So anything that we can do to, kind of help offset that and even just try to get closer on a level playing field, then that will in turn have better outcomes for mom, better outcomes for our babies. And the same thing with babies. Black babies are dying at twice the rate of white babies.
Okay, so and thank you so much for that, Lydia. So Stephanie, what I love about what you do and what your program does, you catch all of this from the beginning. Okay, you come in and you coach them, you nurture them, you help them to be healthy, wellness. You do all of these things. So take for instance this and this plat. This is not this we're not doing anything about race. This is not what this is about. But take for instance, if an African American group did come to you and say, well, we want you to help us, Ms. Stephanie, how would you be able to encourage them? We know everybody have different communities, they have different cultures, people do different things, people eat different, they have different environments and what have you. So what would you do in your terms, in your perspective, to be able to break that stigma over any type of, minority, whether it's Hispanic, Indian, whether we deal with women Czechoslovakia, because we have all types of tons of cultures here in the U.S., which is a wonderful thing. But if someone is coming to you and they say, hey, we want your help too. So kind of walk us a little bit through that, Stephanie, so we can so hopefully this video can be able to even encourage others.
Yeah, it really all comes down to respect. And part of what Dancing for Birth classes is doing is restoring community and bringing women, babies, birthing individuals and their partners together in circle.
Okay.
And we're, always diverse and always learning from each other. So there's the
Yeah.
instructor there who has a lot of experience, but we all learn from each other
Yeah.
organically. And it's really important also to have both groups. So pregnant and new parents together, because then you help each other along and mentor each other. You bring in aspects of your heritage and your culture and your values and what's important to you. And we learn from each other. And we do need the care providers to also have that same mindset of respect and listening. So in class, we're learning how to tune in to our bodies, our babies, our birth instincts, our gut instincts, and then be able to communicate that. And then on the other side, we need care providers to listen and hear and value what we have to say, value our gut instincts and our own expertise about what's going on with our bodies. And we need that respect for everyone, regardless of where they come from, how they look,
Right.
what age they are, what nationality they are, what language they speak. So that respect has to carry all the way through.
Okay.
And there's a really interesting study that came out in 2020 called Physician-Patient Racial Concordance and Disparities in
Okay.
Birth Mortality for Newborns. And it says in the United States, Black newborns die at 3 times the rate of white newborns. But when Black newborns are cared for by Black physicians, the mortality penalty they suffer as compared to white infants is halved. So
Wow.
that's really something to let
Yeah.
sink in, that we can be saving a lot of birthing individuals, a lot of babies, by understanding that this relationship is very important and that respect is very important in the listening.
Okay, absolutely. Because I think it's very important that the doctor commingles, not just because it's money or he's going to get $15,000 for, or she's going to get $15,000 for birthing a child. I think it's very, very important that they commingle together. And once they bond that relationship as doctor and patient, then that probably can help to move some of the stigmatism as well, depending on if both sides are willing to have and bond that relationship for that. Well, it's not basically 9 months. Some people still come to the doctor even after they've had and birthed a baby. So I think that's very, very important. This question is still for you, Stephanie. I think I exercised all the way up until about 9 months. So a lot of women have a lot of questions in regards to how long should they exercise. I've seen women still be doing basketball. They be, still be playing tennis at 6 months. And so, of course, we don't want to fracture the baby. We don't want to, get into any safety issues where we may fall and harm ourselves and what have you. So what do you advise your group, your women, your clients in regards to health? How long can they be able to exercise? Basketball, some of them are still swimming all the way up to 8 and 9 months. I know one of my issues was I had a bad back problem with the second one, almost 30 years ago and what have you. And so sometimes women are seeking out for issues. I mean, they're seeking out for answers when there's an unrest, that's going on. And so sometimes we have went to exercising in order to relieve some of that. So talk to us a little bit about that.
There's a myth that, first of all, that you shouldn't, that you're fragile and you shouldn't move a lot until after 12 weeks. And so I just want to dispel that myth, that if you're a healthy individual and you are pregnant, you don't have to consider yourself to be fragile. You're strong, you're powerful, and you can continue to enjoy all of the activities that you did before you were pregnant, even if they're high intensity. If you have never exercised at all, this is a good time to start, but you would start with low intensity or moderate intensity. And you can do that through all 3 trimesters. You can do that all the way up until you go into labor. And then, as I said, you can actually move in labor, and it can help facilitate the progress of your birth. And after you give birth, you don't have to wait for, let's say, a 6-week checkup to then start moving again, because you really want to, of course, listen to your body, not overtax yourself, but do what feels good, because that movement is going to help you recover. It's going to help with your mental health. And you want to be able to get up and get out and do the things that you love. So what the kind of caution I would say is, if you have previous to pregnancy been doing some extreme sports, perhaps, downhill snow skiing or something, with a high likelihood that you could take a tumble, you might want to back off of that.
Right.
But if you're a marathon runner, you could still run marathons when you're pregnant.
What?
If you ride horses, you could still ride horses when you're pregnant, and science has proven this.
What?
So you should really feel, strong, and do pay attention to your intuition, because that's going to tell you if it's time to back off a little bit or slow down a little bit.
Okay, because sometimes, we're I'm from back in the 60s, late 60s, early 70s, and so, back then, they tell you, oh, it's gonna, you ride the horse, you do all of these exercises, the umbilical cord is gonna wrap around the baby's neck and choke them, because people had home remedies. They did not rely on the doctor and what have you, things like that. And plus, back then when I was, coming up, that doctors was visiting the patients at home. So that's the reason why I just kind of asked that question, so we can be able to get the up-to-date and revised information as to the healthiness part of what we can be able to do. People love to play racquetball, tennis, and things like that, and we shouldn't rely on old remedies if there's new things that we can be able to do and be successful in that. Keep from the woman just laying on the couch and just eating, because that was one of mine right there. I just drunk Cokes, and this lady told me, she said, look, them pounds are not going to come off. They're not going to come off. And look, it did not come off, just like this other lady that gave me the advice. So look, no junk food, not an excessive junk food, and no acid drinks, because I'm serious, that stuff stick to you after birth. So thank you so much for that, Stephanie. So Lydia, did you want to comment on that?
Just that movement throughout your entire process is very important. Actually, continuous movement throughout pregnancy that has been shown to shorten the length of your laboring stage, because your pelvis, it is supposed to move. So doing different exercises like curb walking, like Stephanie said, if you're not someone who's already been doing high intensity activities, don't start doing CrossFit your 6th month of pregnancy all of a sudden, if that's not something that you were previously doing. It could be as simple as taking, a walk around the neighborhood, or, if you got some stairs in your house, just take some time, 15 minutes a day, do some stairs in the household, because that is going to help you. Number one, your heart is a muscle, and so you have to get that heart muscle prepared for the birthing process, because whether you get an epidural or not during labor, your body is going through it. So it's like the equivalent of running a marathon. So you want to make sure that your body is in a healthy point, that it can maintain that process safely. And then also during the postpartum time frame, you do want to make sure you're moving, not overdoing it, but that will also help with the healing and recovery process. So don't just sit on the couch eating bonbons, like we said earlier. It is important to move. Every person is going to have their own individual point where it's like, okay, this is all I can do, and that's okay. Don't look to the next person. Just listen to your own body. What am I able to do right now at this phase of my process?
Okay, great. So this next topic we're going to talk about after the baby. And so we know that women suffer a lot of this, which is the postpartum. And we're going to talk about that. First of all, we're going to define postpartum. And then we're also, I want to share a little story of what one of the individuals here in our location in the state of Tennessee, what she went through. Here's an African-American couple. They live in a very high profile location. They had 4 children. The husband, and we're not here. We don't want to be judging and being biased. I just didn't understand the mental issue of it, especially if a mother has if she has some symptoms of having mental issues. My thing is, why didn't someone reach out to get her help? I'm serious. It's finna go deep, y'all, okay? If you don't feel comfortable in answering the question, just pass it on to the next speaker between Lydia and Stephanie. So what happened was, while the husband was outside barbecuing, see, that's the reason why I say it don't have anything to do with race. This is an African American couple and a very high profile living. While he was outside barbecuing, she was inside killing all her 4 kids. Right now, her case is still open. This happened about 4 years ago. Her case is still open. It's a very high profile case in the state of Tennessee. We want to kind of talk about the importance, especially if the spouse knows that there is an issue. How can he address it? Who can he talk to? Who can he reach out to? We're gonna start with Stephanie. Kind of share with us a little bit about postpartum and why it exists, and then we'll go to you, Lydia, and then we'll talk about some things. And we'll get your take on both of that, of what I just shared. I'm serious. It's an emotional, issue, and it's just not African Americans. It go on with other women. I think it was another mother. She was white, and she drove. I think she was the one that drove her and all of the 5 children
Yep.
into the lake.
Into the river. Yep.
That. I mean, and we're, like I said, we're not here to judge. We're here to help the women so they can have some help, some resources. Who I need to talk to? What does the husband need to do if he sees the problem and he don't know who to reach out? Because it's hard for a husband to go in there and say, "Look, admit my wife to a sanitarium." That's difficult to do. And so nobody probably don't feel comfortable in doing that. So we want to talk about it though. Okay, so share with us, Stephanie, a little bit about postpartum and why women break down after the birth.
Yeah. So that time period after you have your baby is the postpartum time period. So every single person who has a baby will have a postpartum period. But postpartum blues or postpartum depression, or even beyond that to a more serious mental illness,
Okay.
can happen to some people. And it's not something that should be stigmatized. So it's something that people, like you said, partners, if they see something's not right, then they need to bring that to their partner's attention and, mutually decide to go get some help because, things that might be little red flags or warning sign is not feeling like you're bonded with your baby or that you're putting a high priority on how your baby's feeling and taking care of your baby. It's okay to not be happy all the time. Parenting is hard. You can have ups and downs. You can be happy one minute and sad the next and find the whole thing difficult. But if you're consistently not feeling like a strong bond with your baby, if sometimes you think, who is this person in my house, this little person? I don't even really know who you are, or why am I bending over backwards for you? If you're not motivated to care for that baby or even care for yourself, those are all warning signs to get help. And postpartum depression can affect a lot of people. So don't feel embarrassed about it. Don't feel like there's something, to be ashamed of. So go get the help. It is a condition. It's not something that you can just will away or wish away.
Yeah.
And I would say that it's, going back to the birth to help then prevent postpartum depression from happening. In pregnancy, that movement is very important because movement can help prevent depression of all kinds. During the birth, we're supposed to get huge doses of oxytocin, which is a happy hormone that also creates love and bonding.
Oh.
And sometimes when birth is over medicalized or if it started with artificial oxytocin, you might hear of it called Pitocin. or if it's sped along with Pitocin, then that can deprive us of that natural oxytocin that we make. And that can play into, having postpartum depression, because we haven't gotten those high doses of our natural hormone that's helps us to be selfless and to really be bonded with our child for life and want to take care of them above all else.
Yeah, absolutely. Because, even when I hear these types of stories, no matter what side of the fence that the mother may be on, it is so dramatic. I don't even, I'm like, this lady does not need none of them. Those are just two of the cases that I can bring to mind, but they don't need to be in jail. They need to be somewhere where they can be. It's kind of hard to address. I'm serious. You don't know what's going through their mind, and perhaps sometimes you can be in the same room with a person, but you don't know how to address your spouse or your significant other about things that you're having. Having to change the baby. The baby's crying, and then sometimes men and things like that will put all the responsibility on the women to be able to do all the birthing and everything like that. But at the same time, that's the reason why I brought the question up. It is very, very important. Postpartum affects a lot of women in the United States, and so unfortunately, some of the women they can't get the help, or they don't want the help, or sometimes people cry out in different ways, and no one is watching, paying attention, or listening to some of the signs that is right there before our very eyes. And so this other lady, her case is coming up. All of her children are dead. You don't have your husband no more, and you got to come out of this expensive community, but you're in jail eating jail food. And so it's just so heartbreaking. And just wanted to talk about it. We're going to go to Lydia, and we want to kind of see what your take is on that as well.
Yes. So this is something that has become more common. You're referring to postpartum mental health issues. Postpartum is the time period after you give birth. So no matter if you had a baby 2 weeks ago, a year ago, 5 years ago, you are still technically postpartum, because broken down, the word literally means after birth. So once you have given birth, you are forever postpartum. When we're talking about the different mental health disorders that come about, most often people think about postpartum depression, but there are others: postpartum OCD, postpartum anxiety. The cases that you're talking about is when postpartum depression is left unaddressed. It can then turn into something called postpartum psychosis. So these are very serious conditions that you hit the nail on the head earlier when you said that there were signs before it got that far. Those women definitely exhibited signs. Now, whether the people around them or not saw them or ignored them or just weren't able to recognize them, those women had signs before it got to that severe point. So this is also something that within my business, I address all of these issues with the clients that I work with, because you can find yourself, having what's called the baby blues. That is the first 2 weeks after you give birth. That's considered kind of the normal hormonal shifting balance happening as your body is trying to readjust and find what's normal. You're also recovering from the birth itself. So you may have some time periods where, you're sad, you're tearful, all of a sudden you don't know why, but then, you get over it. Now, if you are having just days on end where you are constantly crying, or you may find yourself in a rage, or even just numb or absent, and things are going on around you and you just feel disconnected. If this is happening for an extended period of time, and then definitely beyond the 2-week postpartum time frame, this is when it is considered an actual mental health problem, and you do need to find support. So going back to, this can be prevented in a lot of ways. The work that you put into preparing for your actual birth process, what happens at your birth, that can be, kind of a causative factor for some of these things. You have women that actually mourn the birth that they had. If you had a traumatic birth, or say you had a woman that was planning on this water birth at home, and somehow she found herself ending up in the hospital in a C-section, that is traumatic for that woman because it's not what she wanted. And it is okay. I always remind my clients, it's okay to mourn the birth that you wanted, and it's okay to, kind of grieve that. But those things, if you have some sort of traumatic birth experience, or maybe it was something with the baby where, baby needed some additional medical assistance, or mom and baby were separated for a period of time, that definitely does affect the bonding experience that they will have initially. And so that can, just continue on into the rest of the postpartum time frame. Things like preparing what I refer to as a postpartum plan. So knowing who is going to take care of what, because sometimes it's just the expectation, like you said, that mom is going to be able to pick up as, 2 weeks after baby's born, dad's going back to work, and, she's alone with this baby.
Yeah.
Maybe she was able to do that with the first baby. She shouldn't have, but maybe she was able to do that with baby number one. And so she had, some mild symptoms of, a postpartum mental health problem. But then you have a baby a year later, and now she's expected to do the same thing with two babies. And then, 2 years later, now she's got 3 babies and she's got all of this on her plate. You're supposed to give your body time to recover after you give birth. And that's mentally, physically, spiritually. Your body does have to heal, and you have to adjust to the new circumstances that you're in. So making sure that you have built community, because if dad is going to go back to work, who can we call on to come help mom? If it's, not the grandparent, sister, cousin, do we have a neighbor? Do we have, someone that goes to the same community center as them that can stop by and, drop off meals, do a meal train? Someone who can stop by for 2 hours because mom has been up with baby all night, give mom some time to rest, take a shower while they tidy up the living space. Those things like that, it helps to take some of the pressure off of women. And you can see if this particular family, when you walked in their house, everything was like spick and span, and that's the sort of lifestyle that they lived. And then 3 weeks after the baby's born, you go to the house and it's a mess. That should be a red flag for anybody who knows that family, that this something is off. Okay. And then another thing, ask the little children if there are other children in the family. Once the spouse goes back to work, you ask them, oh, how's mom doing? Oh, she's doing fine, because when they come home from work, she's not crying at that moment and nothing is on fire, right? So things must be okay. But if there are other children, ask the other children. They'll tell you the truth. I haven't had a bath in 3 days, and my mom is always in the bedroom with the lights out and she's crying. The baby cries all the time. He doesn't stop crying. The little children will let you know a real picture of what's happening in that home. So you have to, number one, make sure that you have gotten a community before birth. It doesn't matter who that is, or some people that have large families, so you can delegate things out that way. Also, hiring a postpartum doula. That is also where they come in. Again, letting you know, hey, is this going correctly? Are there some, abnormal things that I'm seeing in the household? And they can encourage the partner and even mom, hey, here's some postpartum resources. Maybe you should go look into seeing a mental health advocate. It could, be something, having 1 or 2 or 3 appointments that could, save a world of hurt in the end.
Right, absolutely. So here's going to be the last question for our panelists. And so we want to talk about health and wellness after. We talked about health and wellness before the pregnancy. We want to talk about it after. So I'm going to share my own personal experience after I had my youngest son, and this was about, like I said, I don't know, I think it's 28. I think he turned 28 this year. And so my aunt told me, she said, no, why are you exercising only 7 weeks after the birth? And it takes the woman like 6 months before the body goes all the way back together, even though she's not, this old mother wit type of wisdom. I don't know, maybe something she experienced. She had 8 children herself. She did not have no medical experience or anything like that, but we still want to address that as well. The importance of women in wellness, exercising. What type of exercises can the woman do, and how long should the woman wait until she decides until she needs to wait. You know, sometimes you can't just be exercising. I mean, especially if you're not even seeing the doctor after 6 weeks of pregnancy. So we want to talk about that too, to make sure that the woman is healing properly, making sure that her body is coming back together, her pelvis and all of that is coming back together and healing the way that it should. And we're going to start with Stephanie.
There's a myth that you shouldn't start exercising until after that 6-week checkup. But even if you've had a cesarean in the hospital, they want you up out of bed after a certain amount of time. And
Right.
the day after, you know, like, let's get you up and try to
Yep.
walk to the bathroom. So it's okay to start moving. You should start moving. So you want to use your body as a cue to tell you how much to do. If you are getting right into, you know, high intensity activity or moderate intensity activity, make sure that you are not going beyond the point where you could carry on a conversation easily. So you don't want to be so out of breath that you cannot carry on a conversation. If your bleeding has subsided and turned, you know, from bright red to brown and starting to fade away, you don't want to have then bright spots of bright red blood. That might indicate that you're doing too much. So pay attention to your body, take your cues from that. But you want to be able to move and have that joy that comes from doing things you love, you know, walking in the park, dancing around your living room, playing with your children, you know, going back to your fitness class.
Okay.
And yeah, you can start doing that right away, but don't do, you know, don't do what people say you should be doing. Do what you know you should be doing based on how you're feeling.
Okay. Okay, great. Lydia?
Yep, that's absolutely correct. The activity that you have in the postpartum phase, it really is dictated upon the personal experience. So we can't say, you know, every woman should start doing something at, you know, this point in her postpartum phase, because every woman experiences a different sort of birth, and they also have different medical and health issues outside of, you know, the birth itself. So generally the 6-week, you know, kind of milestone that people are looking for is because it takes about 6 weeks for the process of involution, which is the uterus stretching, or, you know, coming from the size that it stretched from, shrinking back down to your pre-pregnancy size. So
Right.
that's about how long it takes. And you can have bleeding for up to 6 weeks after you have birth or give birth. Some women, you know, at 3 weeks postpartum, they're not having any bleeding. And so maybe they start to feel good and they go about their normal activities. But if all of a sudden now they are having that bright red bleeding again, that's a cue to them that, hey, I'm doing too much and my body's not quite ready for this. So then you would want to pull back on whatever activities you had begun. Also keep in mind that the snapback, you know, term is not realistic. A society likes to think that, you know, you're supposed to be your pre-pregnancy weight after you know, give birth, like 2 weeks later, and you're starting on that fitness journey again. No, once you give birth, you're leaving your birth facility looking like you're somewhere in the second trimester, okay? It took you around 10 months to grow your body into this beautiful form to carry your baby. And so that said, as soon as the baby's out, your body's not going to go back to what it was. And some people, their body literally never returns to the pre-pregnancy phase. And that's because they're no longer pre-pregnancy, they're postpartum, right? So just make sure that you are taking those things into account, and you have to do what feels right to your body, and have realistic expectations, because definitely, you know, society's pressures, I think that often, you know, makes women make, choices that are not the wisest because of the pressure that they have to feel and look a certain way. And we have to remember, your body has just gone through, you know, such an amazing process. You brought forth life to the world, and you have to respect the new body that you have.
Okay, absolutely. So we're going to have the final word with Debbie. So Debbie, we want you to kind of sum all of this up with the expertise and knowledge that you have, that you can be able to bring to the platform.
Well, I think that every educator, every doula should be listening to your podcast here, because so much wisdom has been shared.
Right.
But I think the main thing that we want to portray to our parents is that life is an ongoing thing, and this is one special section of your life. So we can't get caught up in, I love what you just said, Lydia, mom's feeling like, oh, I'm going to go home and wear my size 4 jeans again. That's not going to happen. So, but what we can say, and respecting your body is such a good thing. We can help them, especially if you get to work with them through the whole spectrum of birth and postpartum. We can help them see the string of how that works from the beginning to after the baby's born, and knowing that they've just created life and that they have done this wonderful work. And then from there in postpartum, to stand with them as a postpartum doula, or maybe just having them be able to call you back as an educator or something, and helping them understand, helping their family, the people around them understand what postpartum mood disorders look like, so that they can jump on that and not wait till tragedy strikes. I just love what everybody said, the movement, the nutrition, all of that, all of those pieces are so important, and just really helping women understand that getting education is going to be the key to success in all of these areas.
Okay, great. Thank you so much for that. So here is the fun part for our guest experts, for Lydia and for Stephanie. You both get an opportunity to be able to share with the audience how they can be able to reach you, how they can follow you on any social media platforms that you would like to share, or any upcoming master classes that you may be sharing, anything that you may have to offer to the public, where they can be able to also get resources for the postpartum. That is very, very important, where they can be able to get these resources. And if you offer the resources yourself, of course, you can be able to share that as well. So we're going to start with Stephanie.
Yeah, I am so excited to invite everyone to come to the website dancingforbirth.com. And that's for parents and for birth professionals. So if you're pregnant or a new parent, you can come there to find a Dancing for Birth class. And these happen weekly all over the world, in person and also virtually. They're offered in multiple languages. So there's something there for you no matter where you live and what your circumstance is. And so you would do that when you first start thinking about having a baby, through any trimester, all the way through. And then after your baby's born, you stay in the same circle. So you're really creating this community, and you have your experienced mentor there who's your certified Dancing for Birth instructor. So you can view the schedule there and find a class near you. And if you're a birth professional, then you can get professionally trained by Dancing for Birth. So you can use the Dancing for Birth childbirth method during labor to assist your clients, to assist your patients. And then you could also become certified to teach Dancing for Birth classes in your community. And so again, that website is dancingforbirth.com. And you can also come to our Facebook page, which is facebook.com/dancingforbirth. And we're on Instagram at dancing_for_birth. So we look forward to helping you just have a blissful and wonderful pregnancy, birth, and postpartum experience. And I would also definitely like to share a resource. Yes. So for anyone who is needing some support after birth, perhaps because of miscarriage or stillbirth, there's a wonderful national organization called SHARE, and that website is nationalshare.org.
Okay, great. Lydia?
Yes, thank you so much for your time today, Diane. Has been an awesome conversation, and I hope that it reaches the people that it needs to, whether in a professional aspect or a personal aspect. Anyone can reach out to me directly by going to the website laboredwithlove.com. I'm also on all social media platforms at laboredwithlove. So I am local to the Kansas City area currently. However, I provide virtual services everywhere. I've assisted families in Germany, Korea, everywhere. So if you are looking for doula services to aid in your pregnancy experience, If you are wanting to help come up with a birth plan, postpartum plan, if you are needing assistance with breastfeeding, so you're looking for education prenatally for breastfeeding, childbirth classes, I offer all of those things, as well as on the postpartum side of things. I am an international board certified lactation consultant, and often people will qualify for 6 or more free lactation appointments with me. So that's always something I encourage people to take advantage of. So I'm excited to, just have this opportunity to speak with you guys, and I look forward to getting some more opportunities like this in the future.
Okay, great. So, everyone, there you have it. We have discussed, and these professionals have unloaded a packed full of tons of knowledge, wealth, resources for you to be able to have a healthy pregnancy. We talked about the before stage, and then we talked about, once the information that you need, the Lamaze classes. Then we talked about, when you go into the labor and delivery. Then we talked about after, and then we talked about the postpartum. And then that is so important. Once you know that someone is going through something mentally, especially say something, open up your mouth. If you can't do anything but write it down on a piece of toilet paper, like Judge Marilyn Millian says on the People's Court, write it down on a piece of toilet paper and just pass it to the individual, just so long as they get the help. We want women to be able to be successful on these birthing pads before, during, and after. We don't want to hear about mothers driving their children into lakes and chopping them up with. We don't want any of those things to be going on. And then too, with the weight, it's very important for you to be able to feel good about yourself. It takes a while for your body to mend back together. So be thankful that you have made it through a successful pregnancy. And not only that, give your body time enough to be able to adjust to the new you. And so with that being said, we would like to thank all of our panels, and we thank also Debbie for being with us and sharing a lot of tons and resources with us as well. And so we will see you all next Thursday on Women Who Rock with Success Media. Thank you guys for being with us on today.
Thank
Thanks,
you.
Anne. Thanks, Lydia. Thanks, everyone.